There's a lot of panic in the last few days. People are asking me all over again, the COVID has come back. Is it going to be a big problem as it was last time? The new mutation, is it dangerous? What medicines can we take? Do we need the vaccines? And do we need to get tested or get admitted? Yes, it is true that COVID has come back. The new mutation, which is referred to as the JN1 mutation, is just the grandson or the great grandson of the BA.2.86 Omicron strain. This is fortunately a mild infection, though it is highly infectious. The symptoms are the same like the Omicron variety, which is it may start with a scratchy throat, a runny nose, body pains, fever. Some people also complain of loose stools. There is persistent cough, and the whole infection lasts about 4 to 5 days at most in most people and then settles down within a week. Most people do not need hospitalization, but the elderly, people who are frail, people who have multiple comorbidities, and people who are immunocompromised can all have severe disease in spite of the vaccination, because the vaccination may not be protective against this strain. Is there a way to differentiate this strain from the flu? We have been having a lot of cases of flu in the last 3 months, and the COVID, which is presenting now, is quite similar to the flu, what we refer to as the influenza-like illness. So clinically, one cannot differentiate between the flu and the COVID, which is circulating now. So how do you diagnose the condition? In most young people where you suspect the possibility of a COVID, all you need to do is do what is called a syndromic diagnosis, which is the influenza-like illness. Assume that it could be either the flu or the COVID. You need to isolate them for at least 5 days. Ensure that symptomatic treatment is given in the form of paracetamol, cough lozenges, and a suppressive cough syrup. Most people do well with this. Diagnosis is indicated mainly in people who are hospitalized, who may be unwell, for us to know what is the condition, to put in processes to isolate them so that it doesn't spread, and maybe think of specific treatment. What kind of specific treatment is available? I'm sorry to say that the usual medicines, that is remdesivir, which was given during the last outbreak, is not available freely now. There are problems accessing it. This remdesivir could be given in patients who are at serious risk of complications as a preventive therapy of 3 days duration, even before their oxygen drops, or if the oxygen saturation drops below 94%, the patients may be given a 5-day course. But this is not available right now. What are the other medicines which can be used? There is a medicine called Paxlovid, which is available in the US, which is basically a combination of nirmatrelvir and ritonavir. This is also not available. This is given to people with multiple comorbidities to prevent complications of COVID happening. This has to be taken 4 tablets twice a day, and unfortunately there are a lot of drug interactions, so one has to be very clear that the medicine doesn't interfere with previous medicines, especially the anti-cholesterol medicines and certain other drugs they may be taking regularly. So this is also of limited availability, which means that treatment, specific treatment modalities for COVID is very, very limited at present. Having said that, I reiterate, the strain which is circulating, the JN1, even though it is highly infectious, it is still very mild and in most situations does not cause any complications. So what would be my advice to people during this times of this COVID spread? You can see me. Make sure you wear a mask, especially when you are out in amongst crowds, when you are traveling, when you are attending functions. This is the best way you can prevent transmission of COVID. What about vaccinations? Unfortunately, again, no vaccinations are available. The vaccinations we took in the beginning, the Covaxin, the Covishield, are all what we call as the monovalent vaccines, which are vaccines which have the original Wuhan strain of the virus. Subsequently, with the advent of Omicron, most of the Western countries have the bivalent vaccine, which contains the original strain plus the Omicron strain lineages. What is called the XBB 1.5 variant is a vaccine used for the Omicron strains. So using this bivalent vaccine is what is advised. There is no role for the monovalent vaccines at present. There is only one mRNA vaccine currently manufactured in India, which is available, which contains the Omicron strain. This is available. This can be entered into the COVID portal, but it is still limited. So if there are people out there who are either immunocompromised, who are elderly, or who have multiple comorbidities with a high risk of running into complications, taking this monovalent but Omicron containing vaccine is what is advised. So stay safe, mask up, and in the event of problems, especially in the elderly, please contact your doctor to see whether you need the COVID test and whether you need close follow-up.